I think it's absolutely okay. I think the way I would explain that is similar to like WebMD, basic internet searching. AI is a good resource for patients to get basic education about their condition, possible treatments. I think it really opens the door for a good conversation with their physician about treatment options that maybe weren't discussed at previous visits. So, overall, I think using AI for health information is overwhelmingly positive, as long as a little bit of guardrails and common sense are applied. That you really need to do more research and not necessarily take direct medical advice from AI, which most platforms I've used, they're pretty quick when you ask them medical questions. They're very quick to point out, I'm not a physician, this does not replace advice from your physician, things of that nature. Unfortunately, no, we're not there yet. I think that the biggest piece to understand there is, when you go to the doctor, your physician is reviewing a lot of medical records before they actually see you. They obviously have records from all of your visits with their office, and so they have a lot more data and information. AI is really good at sourcing, internet data, but it does not have specific information about you, your condition, previous treatment history, all this sort of stuff. And so, a lot of times, AI can help give some general medical advice, but certainly would never replace your physician who's going to know a whole lot more about you. And a lot of the decision making for chronic pain patients, it's nuanced, right? There's lots of different medications, lots of different procedures, and we really try to customize that to the specific patient. And AI is just not quite there yet. They don't know enough about you to make really good medical decisions. Yes, the risks are there. They're certainly real. I think to me, the big things that come to mind would be, one, relying on AI medical advice could, prolong a patient going and seeing their physician. It could prolong, appropriate diagnosis and treatment. In that same vein, I think the other risk is that, patients get misled, misdiagnosed about their condition, and they kind of go down the rabbit hole of looking at alternative treatments and things that maybe are good for certain conditions but don't apply to their specific condition. So those are probably the two biggest concerns I would have about leaning too heavily on AI for medical advice. Obviously, AI is a hot topic across the country, across the world. AI has found its way into most everything, including medicine. I think patients should understand where we're at right now as a medical community, as physicians. Most of your physicians are probably interacting with AI in some capacity. A lot of that we're familiar with is more in the realm of documentation. So when you come to the office, you may have the physician ask if they can record the conversation with their phone, and that is using AI technology to summarize the conversation, to put it into the medical record, which I think is overwhelmingly positive. We're capturing more accurate information about you and your condition when you're here. I think some physicians are starting to use AI similar to how patients use it, in terms of looking up rare conditions, kind of fact-checking certain treatments and certain conditions. We're not quite there yet, but I think the next horizon is AI will find its way into true medical decision-making. I think a lot of physicians believe that AI can be a tool that can help, educated physicians make better clinical decisions using a lot of data and analytics on the back end.